Let's get some more insight on this from Yousra Abu Sharekh. She is the Gaza Program Coordinator for INARA, a nonprofit that provides medical and mental health care to children affected by human-induced or natural disasters. Thank you so much for being with us on the program, Yousra. I want to start off by this report that we're seeing from UNICEF. You work with mothers, with pregnant women that are suffering the most dire conditions there in Gaza. Walk us through some of the experiences they go through.
Yes, actually, pregnant women and lactating women as well are facing harsh and very serious risks when it comes to accessibility to food, because even with this very limited amount of trucks are allowed to enter Gaza Strip, nutritious food is not available and affordable to all families in Gaza Strip. So those pregnant women sometimes go to deliver and to give birth while their blood is below 10, the hemoglobin level. So we talked and we visited cases who have experienced so much of serious risks related to food and nutrition. So it's not only about food as well. So the medical supplies and medicines are not allowed enough to enter Gaza Strip. So imagine, even if pregnant women go to have the follow-up or checkups for their pregnancy, they don't have access to micronutrients or folic acid, for example, or these kind of medicines and supplements that are crucially needed and required to deliver healthy or healthier babies. So that put additional layer of suffering and risks on the babies that are delivered underweight and malnourished already, even before they come to life. So yes, they are now also are facing very serious conditions related to the cold and the weather. You know, now another the second storm hit Gaza Strip while people live in very vulnerable conditions, in tents, partially damaged houses, or sometimes they don't have not only like adequate tents or plastic sheets, but also they don't have clothes, warm clothes to protect their children. So the situation in Gaza is getting worse and worse, and like people and the international community should support and advocate more for allowing the winterization kits, the tents, and even like it's not only about tents, but also the spare parts, the heavy machinery, to enable the environment for them to live in better situations.
Right. I mean, the number of babies dying has increased by 75% compared to war levels there in Gaza. Just to grasp the situation a bit better, Yousra, talk to us a bit about how hard it is to actually access aid there in Gaza. What lengths do people have to go through to get food, to get medicine, to get adequate shelter?
The situation on the ground in Gaza Strip is unexplainable still, even with this ceasefire into effect. Honestly speaking, I myself met a family that lost their baby due to the hypothermia issue. Also now the organizations are working on awareness to people related to this issue, to protect and to decrease this percentage as much as we could. I met another female, for example, who delivered, and she walked during this season, the winter season. She walked for 30 minutes just to access the healthcare facility, because she's in North Gaza, and in North Gaza there is no healthcare facility that serve and that provide services to people who returned last month to North Gaza. So it's complex. It's and the impact of these struggles and these harsh conditions on their mental health is very obvious. They are so exhausted, drained. Everything is difficult, even if they want to get egg, which is the basic to ensure that they have healthier body. They couldn't access it easily, and it's not affordable. It's not in hand all the time. So the situation is not enabled for the organizations to do the work they're supposed to do, and more trucks are needed here in Gaza Strip, not only for tents, clothes, but also medicines and other materials and supplies to ensure that those, especially the vulnerable groups, are living in more dignified and accessible to their basic needs.
Okay, Yousra Abu Sharekh, thank you so much for being with us here on the News Hour and sharing that insight with us. I appreciate it.